Deși sunt printre ultimele soluții terapeutice recomandate, operațiile pentru slăbit pot schimba viața pacienților cu obezitate morbidă. În cazul lor, sportul sau dieta nu mai dau rezultate, astfel că problemele de sănătate se pot agrava. O destinație renumită în acest sens este Turcia, unde ajung anual peste 700.000 de turiști doar pentru operații de pierdere în greutate.
Așa cum știm, kilogramele în plus nu sunt doar o problemă de estetică. Dincolo de aspectul fizic alterat, grăsimile acumulate în exces pe anumite organe duc la disfuncționalități majore și apariția unor afecțiuni care cu greu pot fi tratate. Obezitatea și diabetul sunt cele mai frecvente.
Obesity is generally defined as having an excessive amount of fat in the body. The World Health Organization has various classifications concerning obesity. These subsegments are calculated by dividing the weight of the patient by the square of their height. The patients with a body measurement index between 25 and 30 are classified as overweight. Those between 30 and 35 are class 1 obese. Those between 35 and 40 are class 2 obese, while those above 40 are class 3 morbid obese. The best remedy for obesity is taking precautions to prevent obesity. However, if a patient has become obese and cannot lose weight through diet or exercise, they may seek surgical or non-surgical obesity treatments.
Chirurgia obezității are ca obiectiv scăderea ponderală durabilă cu ameliorarea stării de sănătate și diminuarea sau chiar dispariția comorbidităților. Există mai multe tipuri de intervenții recomandate în funcție de starea generală a pacientului, o atenție deosebită fiind acordată celor cu diabet zaharat.
In these patients, the pancreas does secrete a certain amount of insulin, yet the tissues resist making use of this hormone. Subsequently, insulin fails to insert the sugar into the associated tissues, and there's a rise in blood sugar. Some type 2 diabetes patients also suffer from obesity, and the body requires higher amounts of insulin. When the pancreas cannot secrete sufficient amounts of insulin to meet these needs, the patient is diagnosed with type 2 diabetes. Sure, while some type 2 diabetes patients are treated with gastric sleeve, we regard bypass methods as the primary treatment. Bypass is divided into various segments, including mini-gastric bypass, Roux-en-Y gastric bypass, transit bipartition, and allele interposition. The common goal of these procedures is to intervene with the digestion of the consumed carbohydrates. By disabling part of the intestines, nutrients are passed onto the excretory system without digestion.
Balonul gastric este indicat pentru pierderea în greutate până la 25 de kilograme, fiind o metodă non-invazivă cu riscuri scăzute față de intervenția chirurgicală.
The gastric balloon is generally recommended to patients who have up to 20 to 25 kilos to lose, or those who cannot undergo surgery due to serious levels of comorbidity or side diseases. It's necessary to evaluate the state of the stomach prior to the operation. We need to check if the gastric balloon patient has a serious ulcer, gastritis or reflux. If these exist, we might decide against the operation. That's why we view the stomach through the endoscopy beforehand. If no inhibiting diseases are found, we place the balloon in the same session. This lasts about half an hour on average. The patient remains under medical surveillance for 2 hours until the effect of the sedation ends, and then they're released from hospital.
O altă variantă este gastrectomia longitudinală, cunoscută drept gastric sleeve. Este o intervenție prin care aproape 80% din stomac este îndepărtat odată cu centrii care stimulează apetitul.
The sleeve gastrectomy operation lasts approximately 1 hour. The surgeons enter the patient's stomach through 4 incisions. A camera is inserted through one of the incisions to inflate the inside of the stomach and view the operation. The stomach is cut loose from the surrounding fat tissue. The stomach is reduced by 80% with the use of medical staplers.
Există multe mituri legate de aceste intervenții, dar în ultimii ani chirurgii au căpătat mult mai multă experiență, iar tehnologiile moderne îi ajută să minimizeze riscurile. Printre cei mai renumiți specialiști în chirurgia obezității sunt turcii, care au numeroase clinici specializate pe astfel de probleme și pacienți din toată lumea vin să se trateze la ei.
We indicate a 7-day period of staying in Turkey. The first 3 days is the operation and post-op period. This is followed by a 3 to 4 day hotel accommodation. At the end of the week, the dietitian evaluates the state of the patient and we see them off to their country of origin. We ask for blood tests every 3 months post-op after they return home. We receive and evaluate the tests via WhatsApp and let the patient know if they lack any essential vitamins or require supplements. Of course, we medicate our patients accordingly after operations. The most important medication is the antibiotics they will use for the first 3 days. These will protect the patient from infections. The others are stomach protective pills. Our patients use them over a period of 3 months, where they will take 1 protective pill every morning on an empty stomach. And finally, there are the protein shakes given by our dietitians. We prescribe a 15-day liquid and a 15-day puree diet following the operation. After these 2 periods, the first month, we start the solid diet. The diet plan after the procedure is the expertise of the dietitians.
Potrivit specialiștilor, pacientul ajunge la greutatea ideală în aproximativ 1 an și jumătate după intervenție. Este important însă ca recomandările și dieta să fie urmate întocmai.